So on this episode, we are going to be looking at acupuncture for neck problems. I'm not in the usual room. I think I've done one or two podcasts from this room actually, but I'm not in the usual room because we're actually recording some of the content in that room. I'm pointing here because it's on the other side of this wall, right? So yeah, and look, it must be nearly Christmas because I've got my Merry Sithmas t-shirt on, and I've got my Christmas Lego glasses that I've just knocked on the floor. Probably going to have to take them ones off because I've just knocked one on the floor. So, neck pain and acupuncture. I think to start off with on this, there's some interesting takes when you look at it from the evidence-based perspective, because when we look at the big systematic reviews with meta-analysis, when we're looking at chronic and persistent pain, obviously neck problems get lumped in with that, right? Because lots of people have chronic neck problems. And that sounds okay. When people have looked at the research that specifically looked at acupuncture for neck pain, it doesn't seem to be as high a quality, or the outcomes don't seem to be as good as when you look at other chronic conditions. But so I'm interested to see how that landscape works over the next few years, because effectively what we have here in the UK is the nice guidelines for persistent pain recommending that we should be using acupuncture for persistent pain problems. So if we're going to kind of use this as our basis, and we use the systematic review of meta-analysis in 2017, which says that acupuncture is really good for persistent pain problems, I think we can kind of put neck problems in there. And as we know that, like any other interventions, acupuncture is not going to be for everybody, okay? It's not going to work for everybody and everything. I think it's just a great option to have for somebody. So I'm going to take a deep dive into, well, what is it, your options? What could you do? So first up, with any kind of musculoskeletal problem, I'm always thinking about, well, where is the problem originating from? So if somebody had a neck problem, but it was radiating down their arm into their hand, say, or they were getting symptoms into their arm, shoulder area, I'm still going to be treating it like a neck problem. And I think what we see sometimes on courses is that people, I can totally get it, look at where the problem is, and they kind of would needle along that meridian, right? And I totally get that. And in fact, there are some kind of sections of acupuncture practices that will do that, so they kind of follow the meridian along. However, we really kind of buy into this idea that you try to treat the root cause. You try to treat where's the problem originating from. So if I had a neck problem and it was just in and around the neck, that feels straightforward, right? You put most of your needles in and around the neck. But if you were getting symptoms that were radiating into the limbs, so radiating into the arms and the hands, for example, I still would focus most of my needles in and around the cause of the problem, i.e. the neck. So I think that's just a really good place to start to clarify where I'm going to go with this. So what options have you got? You have got the bladder meridian, you have got the gallbladder meridian, you have the governor or the Gavner meridian, and you also have the Huatojachi or HJJ. Sometimes it gets abbreviated to HJJ, sometimes people abbreviate it to HTJ. It doesn't really make a difference. Put it in your notes and people will know what they're talking about. But that's really your 4 options that you've got around the neck: bladder, gallbladder, governor, Huatojachi. So if we kind of look at the more traditional acupuncture points first, the interesting thing with the bladder, both the bladder and the gallbladder, is there's kind of a massive gap as to where you can put your needles. So bladder 10 is just lateral to C2, and gallbladder 20 is kind of between sternomastoid, traps, and just below your occiput. So these are really high up on your neck. And so these would be fantastic points for upper cervical pain, and if they're kind of getting pain over the occiput. But then the next set of bladder and acupuncture and gallbladder points are quite far down. So gallbladder 21 is right here over your upper traps. So you've got quite a big distance between the base of your occiput and gallbladder 21 into your upper traps in terms of localizing your needles. And bladder 11, so where bladder 10 is just lateral to C2, bladder 11 is at T1. So there's like, C3, C4, C5, C6, C7. We're missing quite a few levels at your acupuncture for your acupuncture points. And so if you're just looking purely from a traditional sticking to your primary meridians, you feel like, well, I've got a group of points I can do up at the top just below the occiput, and then I've got a group that are kind of sitting around the base, but they're not much in between. And that is where things like the governor and the Watojachi can come in. So the governor, we have some at the base of the occiput. We actually have some over the occiput. And then the next big one is governor 14, which sits just below C7. So those are really good additional points to put in. And then the big ones for me is that if you have specific levels that you think are an issue, so let's just say it's C3, C4, C5, well, you don't have bladder points there, you don't have gallbladder points there, you haven't got a governor point there, but what you do have are the Watojachi. And the Watojachi, or HJJ, they are located at every single spinal level. So from C2 all the way down to L5, you've got a Watojachi at each spinal level. And what's beautiful about these for cervical problems is because you've got that big gap between like C7 and C2, you can fill those gaps with the Watojachi. So let's say it was C3, C5. I will put Watojachi at C3, C4, and C5, and I do all of those bilaterally. So you can really target in super specific levels, super specific segments that you think are an issue. You're not using the primary 12 meridians, but the Watojachi are a well-established group of acupuncture points that people think on and think, right, that really good to like super target that area. I think to complement those points, so, in almost all neck problems, I'm thinking bladder 10, gallbladder 20. I'm normally thinking bladder 11. And then I'm going to throw in a governor 14 and probably some Watojachi for some specific level stuff. To kind of then start kind of branching out, if the pain was radiating into the shoulders, I'm definitely thinking gallbladder 21. I think that's a lovely one to go with. If it's then going beyond the shoulders, I'm not looking for acupuncture points that specifically treat, say, shoulder pain. So there's an example where you could be tempted to, say, go with something like large intestine 15 or triple angizer 14, because if the pain is radiating in the shoulder, you think, oh, well, that's where the pain is. But because the pain's coming from the neck, I wouldn't be using those shoulder points. And if you look at what those points do, they're very good for shoulder pain, i.e. problems that originate from the shoulder. Not where the pain is spreading over, but where the pain is originating from. So I wouldn't go with those points. I wouldn't go with ones that are specifically coded for shoulder problems. But what I could go with is a large intestine 11. So your large intestine 11 at the crook of your elbow, just at the end of your lateral cubital crease, that one could be a good one to go with, because when we look at what that large intestine 11 does from a traditional Chinese medicine perspective, it talks about pain that radiates beyond the glenohumeral joint and pain that goes into the arm. So very much around those kind of neck radiating symptoms. The other points I'd consider would be triple energizer 5. So for me, triple energizer 5 is a really good acupuncture point for any pain that radiates beyond the glenohumeral joint. And it doesn't really matter from a traditional Chinese medicine perspective if that pain is from the glenohumeral joint or if it's from the cervical spine. So I really like triple energizer 5. And I think one of the other reasons that you've got to add that in is that the triple energizer comes over the side of the neck as well. So it kind of links in lovely there. And another little very traditional Chinese medicine perspective here. The triple energizer and the gallbladder are linked in something called the 6 chows. And so actually, if you're going to be needling gallbladder points, it does make sense to needle triple energizer points as well. So triple energizer 5 will be a really nice one to add in there. You've obviously got large intestine 4. I mean, everybody knows large intestine 4. That would be your big one if it's severe pain. So if you've got something like, say, whiplash, definitely large intestine 4 would be where I'd go with that. So severe pain for that. And the last one that you've got to think on is small intestine 3. Now, small intestine 3 might feel like a bit of a random one, right? Because it comes over the posterior aspect of your scapula, and it does come over the side of your neck and into your face, but it doesn't really stand out as a neck problem one. But small intestine 3 in particular has got an interesting link with the governor meridian. And in traditional Chinese medicine, they talk about small intestine 3 opening up the governor meridian. If you think of the governor meridian as a very much a spinal meridian, it goes over all the areas of the spine. And the idea is that if we can open out the governor meridian, we can tap into its chi. We can get things moving around. So small intestine 3 is actually quoted, one of its specific roles is for spinal pain. So that could be a lovely one to add in. I know it's not very comfortable. People often don't like having that one in, but it could be a really good one to add in there as one of your points. Now, a couple of little additional things to think on here. Let's say somebody was getting radiating pain and they were getting it into their upper arm, into their elbow stuff. What I'm going to be looking at is the dermatomes. So that's going to give us a big clue as to what level is the problem at, right? So if they were getting like a dermatomal spread at C5, C6, for example, that's going to tell me which Huato Jachi to use. So if they have a C5, C6 dermatomal pain pattern, I'm going to put the Huato Jachi at C5 and C6. I'm still going to put the other acupuncture points in. So I'm still going to use bladders and gallbladders. I'm still going to use the governor. But in terms of being able to target me stuff, they might often, this can happen, right? They don't actually have neck pain, but we know that the symptoms are originating from the neck. So I'm looking at the dermatomes, I'm looking at what dermatomes they are, and then I'm literally going, right, well, that's the Huato Jachis I'm going to use at those levels. So for C5, C6 pain, radiating the arm that didn't have any neck symptoms, I'm going to be needling C5, C6 with the Huato Jachi. That's how I kind of approach that. To flip it the other way, though, let's say that somebody has a lot of neck pain, and I think whiplash is a really good example of this, but this could apply to any neck problem at all. Let's say that you want to do some range of movement work, you want to do some maybe some hands-on manual therapies with them. It could be sports massage, it could be joint mobilizations, it doesn't really matter what it is, right? But effectively what you want to do is you want to get in there at the neck. Well, if you put a load of needles in and around the neck, you can't access it, all right? Even if you were to put like the bladder 10s and the gallbladder 20s and the bladder 11s, you've got that space in between. I'm not saying you can't do it, but it does get a bit awkward to try and deal around it and try to needle it. So what you could do is you could use this dermatomal segmental approach to actually needle somebody but leave the neck free. So again, if I come back to the kind of the C5, C6 scenario, what I would do here is if somebody had pain over a specific area in their neck, or I was wanting to do some manual exercise-based therapy. So I don't want to put needles in their neck. I look at the C5, C6, and I look at what acupuncture points are within those dermatomes. So that could be something like, I'm just going to use an example of C5, C6. So we could be looking at, say, large intestine 14, large intestine 11, large intestine 10. Those would be like big points, and we do those bilaterally. So those points are in your arm. I'd probably put in the gallbladder 21 there as well. I know that's more like C4, but I'd probably put something in there as well. And what that's doing is that's giving the feedback to the dorsal horn, which is already sensitive, and needling into their arms. Dermatomes work both ways, right? So it sends messages and pain sensations out to the muscle bellies into the skin, but it also takes messages from the periphery back centrally. So acupuncture is working by sending messages back centrally to calm things down. And so although I always ideally like to needle over the specific area, if I can't or I want to do some manual stuff, what's a lovely way to do this is needling into their arms over the same dermatomes that are affected. Still getting my Dai Chi sensation, definitely going bilaterally. I'm probably always going to put a large intestine 4 in here. I know that's separate to the dermatomal thing, but it's just a big pain relieving point. And what I'm then going to do is I'm going to, like every couple of minutes, go back to the neck and see what they can tolerate. So if they can tolerate more manual therapy, if they can tolerate more like exercise-based therapy. And because you don't know when that pain relief is going to kick in. The average seems to be somewhere around 7 minutes, but you might find that some people need a little bit longer. You might find others who need a little bit less. So what I would tend to do is I would needle the arms, leave the neck free, so that's got no needles in there. And then every couple of minutes, just see what that sensation's like. If that sensation is diminishing, the pain sensitivity is diminishing, then I'm like, right, okay, that's going to give me my in to do me manual therapy. So certainly those of you who are thinking about time constraints and thinking about how do I combine me pain relief with perhaps more of me manual and exercise-based therapies, that would be the way that you do it. A couple of other notable points for neck problems. You've got Governor 20, which sits on the top of your head. That one's thought to be about very much about posture and changing your posture. But it does mention about cervicogenic problems that comes into your head. So that could be an option. You have gallbladder 34. So gallbladder 34, which sits anterior and inferior to your fibular head, so like lower part of your leg. The TCM rationale for that one is it helps with all soft tissues. So if you're thinking that this is predominantly a soft tissue-based problem, then it might be a good idea to go with gallbladder 34, because that one is supposed to help nourish any soft tissue problems anywhere in the body. What else might I do? I might go with, so if it was an osteoarthritis or a bony type problem, bladder 11, which is base of the neck, right? You could do that. Well, bladder 11 is referred to as the bone shoe point, SHU. And the bone shoe point is supposed to help strengthen the bone. And thinking that spondylosis, osteoarthritis, that kind of thing, is a bone problem. We're not going to say that you're going to reverse the osteoarthritis here, right? You're not going to change that kind of stuff, but it may help with the pain stuff. And if we go proper into TCM, we know that bone health is dictated by and controlled by the kidney. So if we could do a bladder 11 over T1, we could do bladder 23 at L2, as well as governor 4 between L2 and L3, and then maybe a kidney 3, which is Achilles tendon and medial malleolus in between the two. Now, they all seem really random, right? And I've got to say that if you are more inclined to go down the western route, that probably doesn't feel right, because you've got a couple in your neck, you've got a couple in your back, and you've got a couple in your legs and around your ankles. If you're kind of inclined to go down that traditional Chinese medicine route, then that might be something to offer. Because all of those points are supposed to help nourish and strengthen the bone. Some literature, or some people talk about bladder 60, so that's on your between your lateral malleolus and Achilles tendon. So they talk about bladder 60 is a good point to do for neck problems as well. They talk about any spinal problems actually, but if you think where the bladder meridian runs, it's probably not too much of a stretch of imagination. So I don't know, if you're not happy about I would normally always go upper limb distal points and upper limb points if it's a cervical problem. So, but if you're kind of inclined to think, you know what, I want to add something in lower limb, or you're finding that doing your upper limb stuff isn't working, you're not getting a great response, do the bladder 60 points around your Achilles and lateral malleolus. That would be a good place to go. All right, so in summary, we have a load of points that we can choose from, but not necessarily from the traditional 12 primary channels. So you've got 2 points in the gallbladder and 2 points in the bladder. Gallbladder 20, bladder 10, they're upper cervical, kind of near the occiput. And then you've got bladder 11, which is T1, and you've got gallbladder 21, which is upper trap. So you have this big gap between them. So to help bridge that gap, you've got the governor meridian, so governor 14, for example, between C7 and T1. And then you've got the Huatojachi, or HJJ, which can target very specific levels. And targeting those specific levels can be really helpful if you've got pain pretty much in that mid-cervical region. The other time I'll be thinking about Huatojachi is if somebody doesn't have any neck problems, they have more upper limb problems, but we suspect them as originating from the neck. I'm going to look at the dermatomes at where the problem is, and that's the levels I'm going to needle at. And I'm usually using Huatojachi points there to target specific levels. If you want to be combining manual and exercise-based therapy at the neck, you don't want to be putting needles in and around the neck, so you'll be looking at the arms and the hands, and you're going to be looking at, the segment levels. So again, if you think it was like a C3, C4 problem, you look for acupuncture points. That was a bad example, say C4, C5. You'd be looking for acupuncture points in the C4, C5 dermatome. That will be in and around the arms, and always combine it with something in the wrist and hand. So triple energizer 5. You could go with a large intestine 4 if it was super painful, or you could do the small intestine 3, which is thought to open the gallbladder meridian. If you kind of want to go more TCM, you've got bladder 60 between the lateral malleolus and the Achilles tendon. You've got gallbladder 34 just anterior to the fibular head, which is used for soft tissue problems. And the proper TCM stuff, if you want to go really down that road, if you think it was an osteoarthritic problem, so like a spondylosis, you could go with bladder 11, bladder 23, governor 4, and kidney 3. And those as a combo are thought to help strengthen bone. It's not going to change osteoarthritis, but it might help with some of the symptoms of it. Hope that's helped. And as always, please, if you could like, comment, and share. It makes a massive difference, and we've seen the growth in followers in this over this last 9 months, and it's been absolutely brilliant, and it really does make a difference. Please give us comments, share your thoughts if this has been helpful, if you'd like to see anything else kind of in this ilk, or if you've got any other ideas. See you soon.